My guest is Dr. Ina Harizanova. Originally, she's from Bulgaria. She resides in Chicago, Illinois, where she is coach of the Illinois Fencing Club. She also has a long sporting background herself, having competed at an elite level in modern pentathlon, where she won a World Cup medal. She is also a doctor of clinical psychology and is therefore ideally positioned to talk about our focus, which is on injury recovery and working with athletes and how to help them manage some of the challenges of injury. Great to have you with me today, Ina.
Yeah, thank you for inviting me. Looking forward to talking with you.
Can you talk a bit about your own sporting background? I mentioned you were a pentathlete. Maybe you can discuss how you got into the sport and what the sport is kind of all about.
Sure, yeah. My native city of Varna was big on swimming at the time, and so I swam for many years. And around 16 or 17, that was the age pretty much that I um, had a lot of improvement in several sports, were interested in recruiting me. And I decided to focus on modern pentathlon because it was an Olympic sport and because it offered 5 different sports, new sports that I wanted to learn. And I've always been interested in learning. I trained under several coaches and maybe a little late to get involved, but I knew how to swim, so swimming was already a given. I had 9 years involvement in pentathlon at the highest level, elite level, competing at numerous World Cups, World Championships for juniors and seniors, and 1 World Championships in fencing, individually and as a team, in a team. And I had a couple medals from World Cups in the 90s. I had a few minor injuries, although I spent a lot of time training. I think that the 5 different sports provided an opportunity for cross training, and so I don't remember having a major injury that would sideline me for a year, or had to kind of think about the recovery. Return to play, and am I going to injure again? Sprained ankles, the first time is the worst. After that is very easy and quick to recover. Once you stretch those ligaments, they don't go back.
Right.
And the recovery for the 2nd and 3rd and 6th, whatever, was a lot faster. Within 3-4 days, I was back to normal training. They had some, yeah, go ahead.
Well, I'm just wondering, it sounds like you didn't have that many serious injuries, and I'm wondering, what would you attribute your ability to stay healthy to?
Just the fact that there are 5 different sports and they complement each other, and they're really balancing well the body and the mind. Also, I was really interested in coaching, and so my undergrad is in kinesiology and PE teaching and swimming coaching in Bulgaria from the National Sports Academy there. And I was really implementing what I learned in school, and I implemented in my own training. That's the benefit of getting started a little late, I guess.
Yeah.
And really also a healthy lifestyle overall, in terms of healthy sleeping habits, healthy eating habits. I have had hepatitis twice, once when I was 10, once when I was 21. So heavy foods, fried foods or alcohol were literally out of my diet early on.
Yeah.
And so I think that's it.
Right. So it sounds like you took a very holistic approach to taking care of yourself in terms of sleep and nutrition, and you mentioned being involved in 5 sports kind of really helps balance the body. What are the 5 sports in
Yeah,
pentathlon?
and I have to also mention that my parents are physicians too. So
Mm,
if I needed I am anemic, I have anemia. So if I needed any kind of test or anything, I had a very quick access to evaluation and treatment, which
mhm.
is a huge benefit for me. Um, but I'm sorry, what was the question?
What are the 5 sports in
5 sports, yes,
pentathlon?
5 sports, swimming, horseback riding, running, shooting, and fencing.
Yeah, okay, so fencing is part of it. And
Yeah.
um and you know, it sounds like all of those sports could take certainly a toll on an athlete's body. Um, for a pentathlete or a fencer, what are some common injuries that might be sustained?
I would assume something with the knees for both of those.
Hmm.
Um, I would assume elbows or wrists mainly, fingers mainly, um, because of shooting and I mean, as a pentathlete and fencing, using your dominant hand. Um, Perhaps ankles, maybe lower back. Um, but I think that because of all the other 4 sports, they perhaps are less common in pentathlon and in fencing because you don't fence nowadays. Coaches, I don't, but some coaches require 20-25 hours of fencing a week for a young person who is still growing up. I don't support that, but it's done.
Mm,
And so you don't train that many hours a week of fencing in pentathlon, and you have the other sports to balance things.
yeah. So do you notice, I mean, you mentioned for some young athletes, some young fencers, that they may be training in excess of 20 hours a week. Have you observed chronic or overuse kinds of injuries in younger
Um,
athletes?
no, I think right now USA Fencing is looking into starting there is research started, um, basic kind of descriptive statistics of what injuries fencers come to the trainers at national level events.
Mhm.
That's still in the work, so it would be interesting to kind of see. But knowing how the human body works and knowing how fencing works, one side of the body works in a very different way than the other side of the body. So if you are and if you have predisposition to it and you are required to fence, let's say 15-20 hours a week, maybe more, from young age, one side of the body gets stronger, so it could end up pulling your spine, and so you end up with scoliosis. If this is caught early on, well, you have corrective exercises and whatnot, which takes you from training. um, but if the, the the techniques that the coaches are teaching are not um, the correct form, so they're not paying attention to basic movement literacy, really, even from the get-go. Knees could be compromised, shoulders,
Yeah.
obviously, like I said, mentioned, wrists, fingers, elbow would be. The sad part is that there are some longer terms consequences
Mhm.
that, uh, that are not good. And then that there are ways to prevent that. And if something happens, to deal with it, sometimes so in fencing, um, there are some coaches that are not necessarily focused on the well-being of the fencer.
Mhm. So speaking of well-being, what are some, I guess, challenges that an athlete may face once they experience an injury? I guess from a psychological standpoint, what are some common concerns or things that you've witnessed as a coach?
Well, the pain, physical pain, obviously. And it really depends if it's an overuse injury or it's something that's always just happened and I tore something or stretch something or pull the muscles or something more severe. but pain is always going to be there. That the level of pain and the interference with training process, with just the daily activity. You know, I had a swimmer who had she had shoulder injury, so she had a hard time even just gonna, when she gets out of bed, to put her hair up. So really interference with daily activities. The impact on the team as well, and that could be, you know, how the athletes perceive the injury impacting others, and how the team perceives the athlete that may be sidelined for a certain amount of time. Or it also depends on the coach, if the coach has a way to kind of include the athlete, or if the injury allows that, to continue to be a part of the team, or to provide modified training. And it could also be challenging, I guess, for the athlete to accept the injury, that there is an issue. Sometimes, depending on what kind of assumptions some people are doing, some kids are having, they may even hide it.
Right. So would you say that some athletes, do they deny the injury initially, or when you say they struggle to accept it, is there some denial, or?
Denial is a common first step. And very often, especially I work with kids from 9 to 18. That's pretty much the group that I work with mostly now. It's fine. No big deal. It doesn't bother me. Which I've also seen at the NCAA level, which is the 18 to 22. No, it's going to go away. It's going to go away. Well, how long did you have it for? Oh, you know, it's been a couple of months. What? It has not going to go away. And it's so there's certain, to me, the explanation there could be, you know, I hide it because I'm afraid of the consequences for me and everyone else. Or it could be the belief that nothing can happen to me, which is kind of typical for that age group.
Yeah. So there could be different reasons kind of underlining why they're denying or struggling to come to terms with it. You mentioned that there may be times where they're worried about the consequences. Maybe you can elaborate on that.
Again, that comes with an assumption of the person. I mean, for me, if I have a 12, almost 13, no, 12-year-old, yes, who did not tell me. And I always encourage the kids, we talk about injury, we talk about what's the difference between injury and a pulled muscle, or an injury and something that is uncomfortable in your body. But, you know, we talk about, let's be attuned to your body, and then communicate with your parents, with me, so we could help you out. And then because this girl I just invited to the next level of class of fencing within the program, and so you know, for her, she hurt her back playing with her brother at home, but she wouldn't say, because she felt like, oh well, I don't want her, I don't want Ina to have me stay home and not come to class now that I'm at this high level. Right. And so, you know, we addressed that as soon as, you know, I found out we addressed that. And so she's doing physical therapy, whatever the, you know, specialist, the doctors have recommended. And then at the NCAA level, the person that I am familiar with the situation was hiding because he did not want to be pulled out of a relay. And so that's also, I mean, that's something that stays, that is on their mind. It's not just, I want to swim, I don't want someone else to hop in the water and compete for me, but also there's no other swimmer who can step in my role. Right. It was not a fully funded team. And so there are various reasons for, either hiding it or the denial is very simple. It's just not happening.
Yeah.
When you're kind of conscious and there is something there, there's various reasons.
Right. So it sounds like those reasons may depend on the athlete's age or their status or factors related to their particular circumstance.
And perhaps other, previous experiences, because at the NCAA level, I mean, the kids already have been swimming, 12 years of swimming.
Mhm.
So I don't know how things were dealt before they came to the college level.
Right.
So that could be also previous experiences could also affect their current dealing with.
Yeah. And you mentioned, Ina, that you encourage your athletes to be attuned to their body. And I like that word, or to really listen to what's happening within their body. How do you do that?
Okay. So each class, maybe a class meets once a week, or maybe a class meets 3 times a week. But I call them meditation breaks, but when we have the kids just lie down, close their eyes, and do a short guided imagery session. And so quietly, and then I guide them through engaging all senses. And so, and at the end, we have a check-in. What came up to you? How did things feel for you? And so I find that the younger kids are very open, and they will give you any kind of things that they notice, which is exactly what I'm looking for. And some of the older kids may feel a little bit like the teens. They may feel a little more conscious of, okay, what is everybody else going to say? And so sometimes, initially, when I introduced this, I did the discussion in smaller groups, and then they felt more comfortable with each other, and some were ready to share. And then also we have clinics, annual, like 3 clinics a year that we also talk about, and I provide specific information on injury prevention, and what are the steps that we're going to take. If you feel maybe pulled muscle or not, what step you gotta ice it when you get home, but don't overstretch it, and then keep me posted so I could modify things that you do. And within a week or so, if the pain doesn't go, if it gets worse, obviously we're going to talk.
Right. So
parents are involved as well. I encourage the kids to talk with the parents.
Yeah. And so I was going to ask about the communication piece that you mentioned, and you indicated that, when they do the meditation, I guess that helps them be aware of what's happening within their body and what they're experiencing. But then when you ask them to express it or to share that with the group, does that facilitate an environment where the kids feel like they can communicate about pain or what they're experiencing, or does that kind of help towards that latter goal of communication?
Because I have, and I work on creating positive working relationship with the kids and with their parents, I would say yes. But the other way also to get in tune is when we go into the different positions and we do different steps, footwork skills and so, or blade work skills, I often check with the child or the children in the class, so how does it feel? Where do you feel it? Which side of the body feels tighter? Or, in on-guard position, which leg is tighter, so that we know you feel the muscles tending. I explain also the proper technique as to why we don't want this way, but we want this way, and how the body works. And so it's not just those, meditation breaks, but it's ongoing also during the activities.
Right. And you also mentioned, Ina, that you try and work with athletes to help them distinguish between an injury and maybe, when they've just experienced some kind of strain or something that's maybe training related. So maybe you can speak to the importance of being able to distinguish more benign or harmless pain versus something that's more serious.
Yeah, I mean, the muscle tiredness, I explained that what we do is you're being physically active, so it's normal to be tired at the end of the class. And you may have fun and you may laugh, but once you walk away, half an hour later, you may feel tired, and that is normal. And if there is a pain in particular, or that particular emotions brings, then there is maybe, if it goes away in a couple of days, we understand that, maybe ice after practice or whatnot. Or if it happens during class, well, I see it, or you come and, I always invite them, come and talk to me during the breaks. You don't have to say anything in front of others. Come and talk to me during breaks and let me know if some kids have, when I was warming up, this is what happened. So we address that. And I check with them at the end of class. Okay, oh, it's gone. Okay, great. Maybe you should still ice it when you get home just in case. How are you the next day? Great, we're moving on. Okay, well, that's still there. Well, that's still there. That's still there. Okay, well, what do your parents say? I haven't told them. Well, I think we should bring them on board.
Right.
And so I think the parents are my partners, and I tell them. And so the difference between muscle tiredness and kind of being attuned to muscle tiredness and maybe having something that is longer present is what I have the kids to pay attention, not to the point to kind of being overly kind of self-conscious, but just to kind of notice those things. And it's a learning process.
Sure.
Just because we address it doesn't mean that it doesn't happen. It happens, and we address it as we go. Yeah.
Yeah. So in the case where an athlete does experience pain, for instance, that seems to be an indication of injury. Are there strategies that you employ as a coach to help manage the pain associated with the injury?
I mean, to tell you the truth, for me, pains mean that your body's telling you there is something off. And so I don't see a reason for you to continue to push through the pain.
Right.
Especially with the fencers, okay, you have pain, let's have a seat. That's fine. I said, okay, now let's see, maybe we could walk. Okay, walking well, that's fine, that's great. No pain, great. Okay, maybe we could do some kind of light jogging. Is there pain level? Oh, yeah, there is. Okay, for that. So we could adjust and do today what we can that is pain-free. But if it's something ongoing, I had a fencer with a back problem that the physical therapist discovered that one leg was shorter than the other anyway. So, I work with a physical therapist as well. And so we created a scale system, and I do this often I did so often with the swimmers. And so, okay, what was the highest level from 0 to 10, right? What's the highest level of pain that you had? We have all 7. Okay, what is the pain right now? Oh, it's 2. Okay, if it goes to 3, we're gonna discontinue.
Yeah.
So we modify activity increases in goes to 3, and we'll stop and we'll stretch and let's let it rest. It's good to have you. I'm glad you made it. Let's take care of it.
Yeah. So you're using pain as a guide to their activity levels, or to indicate what they should or maybe shouldn't be doing, or kind of when there's a need to back off and reduce or modify the activity.
Yes, if they are okay to come to practice. So with the swimmers, I work really closely with the trainers and other, specialists that want my support system. But I work with the trainers, and again, if the trainer is not okaying the swimmer to go back in the water, then we say, okay, what can they do in the training room?
Yeah.
What can they do in the strength and conditioning room? Because I can ride a practice on a treadmill or a bike or EFX or whatnot, that's fine. And so as long as it's okay, as long as the sports medicine specialist finds that it's okay for the person to participate to a certain degree, then of course we could modify things.
Yeah.
Of course, I love to have them, and to make sure that they know that they are still valued, that I still love to have them, and that they're still participants on the team. They can still contribute to the team.
Yeah. Is that important, would you say, for injured athletes to know? that they're contributing, that you still want them, or why do you do that?
I think for me as a coach, it is important to raise the kids this way. But again, from the swimmer's point of view, not knowing their entire background of 12 years experiences, I've had a person who preferred to do the workout in the strength and conditioning room kind of individually, because she felt that she would be judged, and she felt like, I had to work towards gaining my place on the team again.
Mm-hmm.
I worked with her. Of course, I encourage her to kind of question that assumption and that belief and kind of see where it's coming from. And I work with a sprint group. And so the sprinters were totally understanding of the injury, but and maybe there is some background experiences that were kind of holding her back a little bit.
Mm-hmm.
So in a way, in her belief system was, if I am not 100%, I cannot contribute to the team, which is a false belief.
Right. So is that important then, Ina, to sometimes question the athlete's belief systems, or maybe there's times where they're kind of creating a certain reality for themselves, and to ask them, to question some of those beliefs, or to help them identify where there may be some flaws in their thinking, or where they may have unproductive or irrational thoughts?
I think so. And I think it's also up to the relationship you have with the athlete. If it's an open, honest communication, two-way communication, and if the athlete knows that they could make a difference, they would be honest. They will be mostly honest, and then you as a coach will feel more comfortable challenging some of those assumptions.
Right.
And also, can you catch them as a coach? Can you catch those false beliefs? And kind of speak to them. Maybe you feel like, oh, no, if that's what they want to do, that's fine. Let's have them do what they feel comfortable. And I think it's also time and place, and how you it's a matter of timing as well. So is the athlete ready to have that communication?
Yeah.
See if that challenge.
Right. So when you say it's a matter of seeing if you can catch them, maybe you can clarify what you mean by that.
Well, I guess it's a matter of, is the coach willing to listen to the athlete, no matter if the athlete performs, trains, or is injured, or talks about just himself as a human being.
Mm-hmm.
I understand that coaches are very busy and they have a lot of people that they work with, no matter what level. I was lucky to have 12 kids, 12 swimmers, so I was very close with them, and I made sure that I developed that, or invested the time and to develop that relationship. But now I have 50 kids, and I still am investing and wanting to get to know them as people, because I think if the person knows that you care for them as a person, they would be a lot more open to share a lot of what's going on for them.
Mm-hmm.
And so if the athlete is still very emotionally charged after an injury, it is normal to expect kind of sort of all sorts of false beliefs. The athlete may or may not share them with you. If they share them when they're still so emotionally hurt, maybe that's not the right time to challenge those beliefs. Maybe kind of validate those experiences, what's happening, not validate the beliefs, but validate the experiences and the feelings that they have for the moment. And maybe as the recovery process, treatment process gets started, maybe that would be the time to address some of those beliefs.
Yeah. So I like how you make the distinction between validating the experience or maybe the emotions, but not necessarily the underlying beliefs. And maybe there's time. You said the timing is important of when you may choose to catch them, I guess, or challenge their beliefs, maybe particularly when the athlete is really emotional or frustrated or maybe experiencing shock or disbelief, whatever it is. That it sounds like that's not necessarily the time to be challenging the underlying beliefs that lead to that emotional experience, but maybe a little bit later in the process when the emotions have or the intensity of the emotions have subsided a bit.
Yeah, that's what my approach has been.
Yeah. And it also sounds, like in terms of communication, that's fostered very much by having a good coach-athlete relationship. Is that the case?
Absolutely, yes. Yes.
So, like in the case, I guess, of an injury in particular, would you say the athlete is more likely to open up to you or to express their physical or psychological pain in cases where there's a good relationship with the coach?
Yes, and I think that also um, when the athlete, because obviously I could have a very good relationship with the athlete when I'm focusing on him or her performing. And so I think that when that athlete initiates something, so put him or herself in a vulnerable position, I think that is very important for the coach to recognize and respond.
Mm-hmm.
Because it could be that the coach misses that moment and that the door is shut. And so I, as an athlete, okay, I understand that being vulnerable or sharing some of those kind of maybe negative, maybe some fears, maybe some negative feelings is not okay. And that would shut, then it's just a once limited relationship. The relationship is limited to only coach performer, not coach and human being.
Yeah. So it almost sounds like there's a bit of a window in which, once the athlete maybe expresses some vulnerability or opens up, that it's important for the coach or, some provider or support system to respond within a certain time frame. Otherwise, that's a bit of a missed chance to validate or reinforce their feelings. Is that right?
I think so. And I think that even if you miss the moment as a coach, if you register, if you notice this, you could still go back and you fight the athlete and say, hey, listen, you said something, I responded, I missed it, I'm sorry, let's touch base again. Yeah. Let's reconnect on that. It seems like important. Let's talk.
Right. So, on that note, I guess from the coach or the practitioner standpoint, just kind of being in a position where you're looking and looking at how the athlete is responding and listening to what they're saying, as you mentioned, kind of keeping your eyes and ears open, so to speak, so that you can get that information and then respond, or if you don't respond, as you said initially, then maybe at least come back to it later on, or at some point in the future. That's great information. Can you talk a little bit more, about some of the kinds of thoughts and emotions that athletes have after their injury, and to what extent maybe those change a bit over time or the course of their recovery?
Well, initial thought would be, what happened? And then the pain kicks in and, oh, that hurts. I guess that would be, this isn't happening. How long will I be out? My parents or my coaches or whatnot will be angry with me. Well, you're fine, you just keep going. All sorts of different thoughts, right, could come. What can I learn from it? That I guess that would come a little later. It could be, oh, now I understand what such and so was going through, because now I'm being injured myself. uh, or it could be finally for a burnout athlete who does not want to, who is either wants a break or wants to be done, because at the college level, there is not everybody ends with the championships of their senior year.
Yeah.
So there are various thoughts in the moment, and it's normal for those thoughts to change. Um, and you said thoughts and feelings, right?
Yeah.
So I guess that would be confusion, that would be disbelief, pain, obviously, right? Anger, sadness, anxiety about the future, the unknown, upcoming unknown time, fear, uh, maybe the sense of being isolated with treatment,
Yeah.
uh, irritated, frustrated with the recovery process, perhaps. Kind of maybe feeling disengaged or kind of left behind. Um, for some people, that could bring a relief,
Mm-hmm.
but it could lead to, it could lead to depression,
Yeah.
maybe substance use.
Right.
Um, and then, of course, changes uh, in sleeping and eating habits. Um,
Yeah. So are there, again, kind of given your expertise both as an athlete coach, what are some ways that you in those roles, or maybe that the athlete themselves can manage some, that abundance of all of those kinds of negative thoughts or uncertainties, or, you mentioned a range of emotions.
mhm.
How can they cope with all of that?
To me, the first thing that comes to mind is seeking support. And if you have a good working relationship as an athlete with coaches and support staff and sports medicine and administrators, if you need to reach out, for counseling, therapy, psychotherapy as well, that's important. And that is something that is also being fostered throughout the years, that it is okay to need help. It's okay to recognize that I need help, and it's okay. You got to learn how to reach for help. Family as well, family members, no matter what age. But in particular, setting new goals, reviewing um, what the season looks like for you, and kind of setting new goals, and uh, trying to keep your daily routine, especially at the college level. You got to continue to keep your daily routine and healthy habits, sleeping, eating, sleeping well, eating well, going to class as much as you can, depending on the injury, obviously. Being focused on here and now, really focus on the present, will help you deal with the anxiety of the unknown in the future. Kind of still attuned with what's going on for you inside. Honor your process, honor your feelings, and maybe challenge, use your self-talk to challenge some of those negative thoughts that, I don't know of a single person who went through injury being extremely positive.
Yeah. Yeah.
um, Self-compassion, and then the tools, like I said, the tools, self-talk, visualization. um, and visualization could be, imagine yourself being healthy, how things would be in the future, or it could be really helping you during the recovering process.
Right.
And overall, focus on what you can do right now, not on what you're missing, not what could have been. Maybe you could spend, obviously if it's a career ending injury, that's a huge burden. It's a huge event that for people with strong and exclusive identity could be experienced as trauma, as loss of self. So that could be addressed differently, and hopefully the person will feel comfortable seeking help instead of having unhealthy coping tools and mechanisms that they're using, but focusing on what you can control right now.
Yeah.
And I think those are some of the things that you can do.
Yeah. Those are a lot of great ideas and thoughts. You mentioned self-compassion, and I know, sometimes there's misconceptions surrounding the notion of what that is. Maybe you could articulate your understanding of the term, or how you kind of use that concept, if at all, with your athletes.
Yeah, I think that kids learn from the feedback from the environment. And so if the feedback is, get up and play, you're fine, push through the pain, self-compassion is difficult to learn. But if the child if I create a safe environment, a safe, positive learning environment, and I attune and I make sure that I get to know the person, the child, fencer, whatnot, athlete, as a person, and I'm able to reflect back or validate as an ongoing process. And if we eventually engage them as they grow in discussion on values, just like that, if they look at themselves as a human being with many interests and engaging many things that I do, and that sport is one of the things that I do, if they look at themselves as a human being, I think that the self-compassion would be a natural, just a natural skill. I don't know if it's a skill,
Right.
or a value, a characteristic, or quality.
Yeah. And I guess, the idea of self-compassion being that the athletes are kind in how they talk to themselves and how they treat themselves, just as they would a friend or someone else. Whereas in many cases, it seems that athletes are notoriously hard on themselves, or they're feeling that if they're too kind on themselves, that maybe they're,
Weak.
they're weak, or that, that they're complacent, or that they're not goal oriented. And that's not necessarily what self-compassion is, right? More just about,
Absolutely. And that is what comes from the environment. So that's our role, to foster in the kids to address the self-talk. We've had many talks, and I've presented to different clubs on self-talk, and I always distinguish the comments that you make about yourself or about what you do. So distinguishing between guilt and shame. Well, opposite, guilt would be about what you do, shame would be about who you are. But they have learned this somehow, somewhere.
Mm-hmm.
And so when we have those talks, that's a good time, I guess, to challenge them and ask where and how you learned this. And would you speak to your friend like that? No, of course not.
Yeah.
What you say to your friend? Well, I'll say this and this. Okay, so what's stopping you of saying it to yourself?
Right.
And I think the change in self-talk and self-compassion would be, the person has to be self-aware and be present just here and now in many situations, not just injury related.
Right.
Because, many times I could be empathetic to my teammate, but when I'm in that situation, I could be very harsh.
Yeah. Yeah. So, realizing that just because you talk to yourself in a kind or compassionate manner isn't inconsistent with still holding yourself to a high standard, or being goal directed, or achievement oriented. But that, over time, if you're saying negative things to yourself, it probably is going to have some detrimental consequences. And it sounds like the first step is also, as you mentioned, just letting the athlete be aware of, or encouraging them to be aware of how they're talking to themselves, right? And to listen, or, to sort of jot down, for instance, these are the things you're saying to yourself, and is that really helping you, or is it perhaps more counterproductive? What are some, I guess, expectations that athletes have of themselves, or maybe even of others, once they get injured, or in relation to their injury recovery?
Well, I want to get fixed right away. I want to go and play right away. So fast recovery, which could be possible depending on the injury. But sometimes they don't want to even give the time needed to establish, what the level of the injury is, and, what the recovery process would be like. So fast recovery, just get it, or I'll just rest, I'll sleep on it, I'll be fine tomorrow. Let's see. They may or may not expect to be active participants in the recovery process. When you're growing and when you're younger, then sometimes, sleep on it the next day, you're fine. But with some serious injuries, beyond just a strained muscle, pulled muscle that happened today, they may not expect that, oh, I have to actually do work, and it's different work, and it's not fun work the way I have in the pool or at the fencing club. So that could be a surprise for them. That may be challenging for them, to adjust to. It may be challenging for them to adjust to different type of workout or modified workout. The expectation may be, the athlete expectation may be based on, again, learning. You either with us, you're in the pool, you're the fencing club, or go take care of, and then when you heal, come back and we'll put you right in.
Mm-hmm.
So the expectation could be that, yes, I need support, and yes, I expect my teammates and my coach and my athletic trainers and whatnot, and my family to support me through this process. And yes, I will be coming to the team at each practice. Maybe I'm not going to be able to participate, but maybe I'll be able to coach, or maybe I'll participate to a certain, to a level that I can. So in terms of expectations, I guess those are my guesses, really.
Yeah.
The hardest one is really concussions, because it's not visible.
Right.
And so the athlete should be the one guiding things.
Mm-hmm.
And other people expectation, I think, especially for the younger athletes, dealing with your own expectations, separating that from others' expectations of you, assuming others, it's maybe very difficult to kind of weed out.
Yeah, so sometimes it's hard to kind of disentangle what's the athlete's, what's their own expectation, or maybe they have assumptions about what they think other people expect of them, and that may or may not be entirely accurate. Yeah. Can you talk about the role of motivation in athlete recovery, Ina?
Yeah.
And you mentioned, I guess, one of the expectations may be that, some athletes think, okay, well, others are here to take care of me, or, they don't necessarily see themselves as an active participant in the process. What's the role of athlete motivation in recovery?
The motivation to get better. That's what you're asking, yeah. Obviously, you can't do anything really if you're not motivated. And the motivation can be enhanced. It cannot necessarily be created. But I mean, it's huge. you you may be motivated not to get better. You may be motivated to stay injured. And so, because you know you don't want to be back, because there's various reasons that could motivate that. But you know, I think that motivation of getting back, if you love what you know what you're doing, if you love your team, if you love your sport, the motivation to get back into it will motivate you to put the work in. Also reframing, what can I learn from this? You know, what is this situation going to teach me? What can I take and keep with me in terms of skills?
Mm-hmm.
Maybe flexibility, maybe being able to adjust to various situations is something that could be beneficial for me in life.
Right.
And just realizing that maybe even not realizing, reviewing, revisiting your motivation to be involved in the sport could be a motivation to participate actively in recovery. I think it's challenging when the injury requires prolonged recovery process to stay involved and to do all activities, and sometimes, especially with secondary injuries, when you re-injure the place, that becomes, then you start questioning on the motivation, and okay, I've done the work and I still got hurt. I mean, I recovered and I still got hurt, and that is that could really affect your motivation of recover.
Right. So particularly in the case of long-term injury, motivation can be challenging, or as you just mentioned, for the athlete who maybe sustains a re-injury or, you know, encounters some challenge or setback, then the motivation can be compromised, I guess, in those circumstances. Would you also, or it sounds like you're also suggesting that there's value in the athlete being in touch with why they want to come back, or you know what sort of draws them, why they're doing what they're doing. Is that correct?
I think so, especially with the injuries that sideline them for a while, not for a couple of days. I think so, and also depends on where they at in their athletic career, and it depends on what sense of who they are they have. If they identify themselves as an athlete only, so strong and exclusive athletic identity, could be crushing, could be a strong motivator to go back because I don't know who I am outside of the sport. Could be a strong motivator to go is prolonged because it's scary to explore and to see myself as anything else but.
Yeah.
Um,
Would you say that athletic identity can be a double-edged sword, and that
of course.
It can be very motivating for the athlete who identifies or strongly or exclusively identifies themselves as the athlete, but can also lead to a lot of negative emotions and frustration.
And could also lead to an injury.
Mm-hmm. How so?
Because with overtraining, because it's I want to get better. I want to do more.
Right.
I want to do higher volume, high intensity of workouts, and which could lead, and I could overlook the recovery process,
Right.
and could lead to an injury. Yes.
Right. Or also, as you were talking earlier, I guess about denial, right? Where maybe if you're so heavily invested in that athlete role that you deny symptoms because you think, oh, you know, you just don't want to recognize them because you know it'll prevent you from engaging in your activity or your sport.
That's right, and that's the denial. You don't even recognize that that's what's going on for you. Yes.
Right. Right.
Yeah.
We've talked about communication, and I'm wondering, from are there things that are important that the athlete can do in terms of their communication with either coaches or treatment providers once they do get hurt?
If the team environment is such that athletes feel comfortable, yes, will definitely, the athlete would be a guide really in the recovery process, in terms of providing, feedback. Okay, this is working, I'm getting better, I'm getting stronger, or this is uncomfortable, or this started hurting or whatnot. So I think that if the environment is such as you're here to play ball and okay, go get fixed, come back, then the communication would not be flowing.
Yeah.
During, regarding injury, regarding the recovery process, they would just be taught that you have your role on the team, that's what you do, and this is, you're limited to this.
Right. Yeah, so it's, a lot of the communication again comes back to the overall environment with that the athlete is operating in, right? If they feel,
I think so.
yeah,
I think so, and it also takes, especially with the NCAA level, that first year, because like I said, we don't know what kind of environment the athlete has had before. Coming in the first year would be important for them to feel safe and comfortable, so that they could have that trust.
right, right. So that trust is important, I guess, again, in kind of facilitating communication, right? If they believe that the coach or the practitioner has their best interests or knows what they're talking about and is competent, then they're more likely to communicate.
That will be heard.
Right, right. Yeah, so there may be concern, I guess, for the athlete that, or there may be reluctance to voice what they're experiencing or their perspective if they feel like they won't be heard, or their point of view is, yeah, right, if they'll be disregarded in some way. Yeah, that makes sense. Sure. Maybe you can talk a little bit about how or what athletes express in terms of when they're ready to return to competition. And I guess I'm interested in this idea of kind of what it means for athletes to be psychologically prepared to resume, more intense or sport-specific activities. Yeah, like how would you say an athlete is ready, or can that be known?
Well, it's not okay, I'm ready. I'm ready. I mean, it's a process, obviously, right? But working closely with the athletic trainers, the okay physically should come from them. I'm not gonna disregard. I mean, I'm not gonna put anyone in the pool if the athletic trainer said that's not okay. But also should come from the athlete as well. So it's those are the two main sources, right? Of I think that getting ready psychologically to return to play could be very different than being ready physically to return to play. And the psychological work can start. I mean, it really starts during the recovery process.
Yeah.
And if it had started during the recovery process, then you would continue as that moves on, as we're getting close to wrapping up the recovery and the treatment process, then a plan, I think if we have a plan of returning and what the steps would be, would help the athlete psychologically to return gradually to play. If there is a plan and the athlete participates in its development, and he or she knows, okay, this is what is, coming up, what the steps are for me to eventually go back into pool or, fencing strip or whatnot. And so with each step as we go, if the athlete isn't tuned, there could be questions again. Okay, am I ready? Because I feel my body is getting stronger. I think, am I mentally ready for that?
Right.
And so kind of checking in. And if, again, if psychotherapy is needed, by all means, that needs to be provided or offered. And making sure that the athlete emotionally, mentally is prepared and kind of taking the steps towards full return to play.
Right. So I like your point, Ina, that readiness isn't just something that happens at the end, but it seems like it's a cumulative process that unfolds really from the time the athlete is injured and begins engaging in active rehabilitation, where that, they're enacting the plan or the steps, and, that sort of sequential or gradual progression is building. And then hopefully there's some sense, that the athlete, they've gone through that process. So that maybe comes into play in fostering or building their sense that they are ready to return.
Yeah, and if there are steps, right? There is a plan of recovery and there is a plan of return to play. If each step is, spelled out, and then maybe each step there is some mental training goals, then that would be adjusted, right, appropriately to each step.
Mm-hmm.
That is more likely that entering the athlete will be physically and mentally kind of in a similar level.
Right. So from a physical standpoint, I guess let's just use musculoskeletal injury as an example. I guess if an athlete has an ACL injury, then there's probably physical signs or indicators that they're ready to return, maybe in terms of like proprioceptive abilities or strength and endurance or balance, maybe different tests that the physiotherapist or the coach might employ. Are there some parallel indicators or signs that an athlete might be psychologically ready?
I don't know if there is a test. Some similarly, or maybe that might be a good idea to develop a test. Maybe there is a test that is developed already.
Yeah.
For mental readiness to return to play after an injury.
Right. There are some inventories that from I can share.
Please.
One. Well, yeah. There's one developed by a guy named Doug Glaser. It's just a short 6-item questionnaire that looks at confidence to return, I guess, and confidence may be one dimension of whether the person is ready. So that, and there's another one that's specific to athletes with an ACL injury, developed by Kate Webster from Australia. So there are a few inventories, I guess, but I suppose one concern with some of those might be that if the athlete really wants to return, then maybe they're more likely to say that they're ready, when in fact they're not. And I guess that's kind of a limitation of a lot of questionnaires, right? As they're subject to.
So that's a self-assessment?
Right. It's a self-assessment. Yeah. And so I guess I'm just, in speaking to professionals and practitioners like yourselves, like one of the things that's come out is things like maybe more indirect observation or more direct observation of the athlete. So, things like, well, how assertive are they when watching their play? Or, if an athlete is given a choice, do you want to engage in this really vigorous activity or something less so, that depending on their choice, maybe that's kind of an indicator or sign of readiness to return. So yeah, I mean, I'm using those as examples. I don't know if in your experience coaching or as an athlete, again, whether there are other kind of signs or indicators that someone might be psychologically ready.
Yeah, I definitely will look into those too. That's interesting to see. The Glasser and Webster that you mentioned, that's interesting to see.
Yeah.
My approach, no matter what level I coach, was more conservative in terms of there is no rush. Let's make sure that you're healthy on all levels.
Right.
Yeah, it's gotta, I mean, it comes from it's very difficult. If you know your athlete, you could have an honest conversation. If the athlete is really strongly motivated and willing to ignore his or her own body, then you're going to have a conversation as, okay, we have to slow down, we have to take care of the injury.
Right.
And if it's someone who is kind of coming to an end of the career and kind of want to prolong that, okay, well, let's have a conversation. This is what the trainers say. Where are you at? I know this is coming to an end. I know you're ready, but we have, a few more months left of the season. How can we make this work the best? That you continue to honor, your scholarship, that you're ready to go. How can we make this work best?
Right. Just a couple other questions here, and I appreciate your time. It's great to speak with you. You alluded to this previously, but I wonder, are there any specific benefits that athletes may achieve or derive from an injury?
Yeah. I would say it really is up to your frame of mind and where you're at in the process. So this could be a learning time about yourself, about life, about your sport. It could be a time that you reevaluate your goals in the sport, or you could have a stock of pretty much of your life.
Mm-hmm.
It could be that which could lead in various directions. It could be a reason for a burnout athlete to say, okay, finally I have a break. I could slow down recover, recharge, and go back into it, or realize that that's not really a burnout. That's pretty much the end. Or that could be one of the outcome of the burnout. That could be my end. It could be a learning experience about others, how others view me in a different role now that I cannot contribute as much to the team. Teammates, coaches, administrators, teachers, parents, siblings, family, friends outside of sports may have very different reaction than teammates. So learning may not necessarily be. Learning is always a good, maybe a little painful,
Right.
but important.
Yeah. So really, a chance to kind of self-reflect in some ways on where the athlete is in terms of their career, or coming back to the motivation piece, like the role of sport in their life and why they maybe want to continue or perhaps even discontinue. Sounds like, they get that chance to do that. Or would you say there are identifiable factors that kind of distinguish the path that athletes take after an injury, whether there may be some that, as you just mentioned, maybe some decide they either don't want to do it, or maybe, maybe they have fears and apprehensions that prevent them from coming, or they just, they're not quite the same. They don't get back to the same level, whereas others maybe come back at a similar level, or manage to come back and still achieve their goals and aspirations. Are there factors that you would say kind of distinguish in the trajectory that athletes take after injury?
Um, I guess we can start with having a correct diagnosis. That would be a factor, and having a appropriate treatment plan. That's not up to the athlete, obviously, right? Or sticking with or following the treatment plan, physically and mentally and emotionally, staying motivated throughout the process, keeping focus on, I want to go back to swimming or to their sport, being able to set those new goals, um, kind of focusing on here now, on the present. Um, I think also it's important to keep a well-rounded lifestyle outside of sport. You have good balance between your physical, your sport involvement and your life outside of sport. Um, Seeking support when needed.
Right.
Physical, that could be practical, just getting from A to B. Emotional, mental. I think that reflecting on the recovering experience and kind of pulling the lessons that you have learned through that time, and seeing how you could apply it moving forward.
Mm.
I guess if a factor would be if you were kept as a valuable team member, a team player on the team, if you felt like you're important team player, important to your teammates, you're important to your coach, your coach was involved or showed interest in your recovery, checked with you and with the people that work with you regularly, and was willing to adapt practices, so kind of work with you within, and the the athletic trainers, and give you training regimen that is appropriate for you, that's different from the one that your teammates have. So I guess again, controlling or focusing on what you can control. I guess those would be the factors that I come to mind.
Well, and I think your response, Ina, really speaks to the complexity of, I guess, the question, but more specifically the process of coming back from an injury and what goes into whether athletes are able to cope effectively, and kind of how they perform or how they do once they do return, or whether they don't. There's probably a lot of factors, I guess, in short, that really go into the quality or the experience that an athlete has in recovering from an injury, and whether they do or to what extent they're able to. So yeah, those are all wonderful thoughts. My final question is whether, or if you could share one piece or a piece of advice for injured athletes, what might that be?
You are more than your injury. You are more than your sport. You're more than an athlete. So love yourself for who you are. You are a multifaceted human being.
Yeah. What if, I guess, just to counter that, what if the athlete were to say, well, no, but I don't have other things in my life. All I've had is sport.
What age? Or it doesn't matter the age? I would address it differently depending on the age. And I'm sorry?
No, go ahead.
Okay. And again, timing would be important for that too.
Yeah.
if I tell you right after, you tore your ACL, there is more to you than this injury, that would not be the right timing.
Right.
That would be completely missing.
Right.
But
So
I think, mhm.
if it was a college athlete, let's say, or someone who'd been playing their sport for some time, I mean, and they said, well, no, I am just an athlete. That's all I'm doing at the moment. That's basically the sum total of my life. So when you tell me as a coach you're more than that, if the athlete refutes that statement, how do you handle that?
I think that would be that could be an open door for discussion, for many discussions. So it would not be just a one-time advice, or that I'm giving, but that would be definitely an opening for a big discussion that could be very interesting, very productive, and life changing.
Right. Yeah. So yeah, something that requires more than just a quick comment, but something that you might have to delve into on multiple occasions or discussions.
Yeah.
Yeah, I appreciate all of your many thoughtful comments and insights, and yeah, just your experience. So I very much appreciate you taking the time to chat with me, Ina.
Well, thank you so much, Les, and I will definitely look at those two inventories and see if that's something that I could maybe modify to use with the kids, because I work with younger kids. But it was fascinating. I think it's an important area, especially now with youth sports being, not now during the pandemic, but just recent years, youth sports being out of control, and the injuries with young kids being so prevalent. It's an important area to develop and learn more in.
Well,
from and in us. Yeah, thank you.
Yeah, no, thank you. And I think your comments help and can be used to help young athletes in particular think about their perspective when they are hurt or injured, and you've offered a lot of very specific points about coping and dealing with some of the challenges of injury. So
I hope so.
For speaking. Have a great day.
I hope so. You too. Thank you so much, Les.
Okay.
Okay.
Bye.